measure number 130, medication verification. This is a telehealth eligible measure. For this measure, we're looking at the number of patients 18 years and older who had documented list of their current medications verified at every visit during the calendar year. This includes both prescribed medications and over-the-counter herbal supplements, and it must include the medication name, dosage, frequency, and route of administration. The first thing I want you to do is check that the filter that you're using for your medication list is Metaspan RX, which will give you the most current FDA list of medications updated each quarter. The two places you can look for this in ECW are in the treatment section under RX Add. You'll see here that there's a place to look for a filter where it says type. There's a pull down and you're going to choose Metaspan RX. You only need to do this once and your selection will stick. The second place that you are going to make this change is when you go to verify the medications in current medication in the patient's chart. You will find this in the filter section here. Under category, you're going to select Metaspan RX. Once you've done this, you can review the patient's medication list with him. Make sure that when you're looking through it, you have all the instructions for the patient. If you see any medications that said DNU, this stands for do not use, and these medications must be discontinued or removed permanently from the patient's medication list. Once you've verified that the patient is taking the medication, you will say taking. If there is a question about a medication that you're not sure of, you should run this by the provider, and you can leave it as unknown for the time. If a medication has been stopped, you can hit discontinued. So once these medications are all verified, you're going to go to the top and hit verified, and you've met the measure. There are exclusions for this measure. If a patient is, for instance, too sick and you do not have the time or the opportunity to review their patient medications, you can select an exclusion for this over in the right chart panel in the clinical quality worksheet. Down at the very bottom, under Other, you will see an option for current medications not documented reason. Click on Exclusion, select the appropriate one. For this patient, I'll say medical reason. It'll ask me to define it a little more carefully. I'm going to save this information, and I will have set up an exclusion for this patient.